أهلا بكم في تلفزيون كارديو أليكس.
And with us now, Dr. Oscar Mendiz, interventional cardiologist. Hi.
Hello.
Welcome to Egypt.
Thank you for the invitation.
Thank you. What are you going to present this year?
Well, this year I'm going to talk about expanding the indication of TAVR for the public, which are the new indications for the percutaneous, through the catheter, repair or replacement of the aortic valve. Because in the last presentation from my previous talk last year, we have a good indication for patients with high surgical risk. But now we have new evidence showing that maybe for intermediate and in some cases for low risk, those patients can also benefit from this kind of indication. I know that here and also in my country we have problems because it's very expensive.
Okay. What is new in the field of intervention in 2017?
Okay, we have been talking a lot in the past maybe 5 years about the aortic valve, but now the field of the other heart valves like the mitral and tricuspid valve are also being treated through the catheter. So we have, maybe not new techniques, but we have learned how to do it much better, safer, and maybe also more effective. And now it's also some new trials going on with the new valves to repair or replace the mitral valve and tricuspid valve.
Okay. What is your opinion regarding the new bioabsorbable stents?
Well, my opinion maybe it's not so favorable so far. For sure, it can be in the future for the stents, but with the data we have so far, there is not benefit to apply this technology to the current patients because maybe our current stents are doing really great, and so maybe there is no reason to use something more expensive that we spend more time doing the procedure. We are gonna expend also more devices. So the issue is we have to improve these devices. For sure it's gonna be the future, but not so far.
When to evaluate intermediate lesions using IVUS or FFR?
Well, we have been treating patients for years only through the angiography, images. Through the catheter, we inject dye, we see how tight the lesion was, and we decided how to do it. And all the evidence about revascularization, not only for angioplasty but also with surgery, was done with angiography. But now we know much better that some of these lesions actually are not so severe. So to be honest, we should use all the images and functional evaluation like FFR or EFR, which is the measure of the blood flow, to say to the normal public, should be used more frequently as we are using now. Because some of the lesions which look severe are not so severe, and maybe some patients who were referred for surgery now can be treated with PCI because they don't have so many lesions, and other patients who receive a stent maybe they don't deserve it because the lesion is not so severe. So to sum up, I would say we should use functional evaluation to decide which lesions are going to be treated, and we have to use IVUS or OCT to have better outcomes of our PCI because it's going to be, especially for left main PCI, better survival.
Okay. What would you like to see in CardioAlex 2018?
Well, if I have to be honest, to see a lot of friends because I've been here for many years, many lovely people here, a lot of friends, but we have good professors from all over the world, so I always plan being here in Alexandria, maybe inspired by the atmosphere of the Biblioteca Alexandrina, and once again because I have so many lovely friends here.
Okay, you're always welcome here. So.
Thank you so much.
Thank you. Could you please tell a word to the world to come to visit Egypt and that Egypt is safe?
Egypt is safe. I've been here not only for science, I've been touring here for many years with my family. I enjoy the history, the culture, the food, and once again, people are really lovely.
Okay, thank you and welcome to Egypt. Thank you.
I hope that you enjoy and see you next year. Bye-bye.